Colorado lawmakers are taking what they call extraordinary measures to help stabilize Denver Health's finances by appropriating $5 million in funding. Now, the hospital reported $34 million in operating losses last year.
And Denver 7's Jessica Porter sat down with the hospital's CEO, and Jess, she says the losses are due to a nursing shortage and more patients being treated.
Yeah, and Denver Health says that they don't turn patients away, and they say uncompensated care doubled since 2020 to $120 million in 2022. And that is the care they give to patients who are uninsured or simply can't afford to pay.
You know, to me, is both a state as well as a city crisis, quite frankly.
Denver Health CEO Donna Lynn says when they notified the city and state of their financial situation and why, officials were surprised. $34 million in operating losses last year. They attribute to uncompensated care as the number of uninsured and unhoused patients doubled.
So we might take care of an acute problem. I like to use frostbite as an example. And then we have a dilemma on our hands. Do we discharge them knowing they are vulnerable and could get frostbite or other things, or do we keep them?
Lynn says their unhoused patients come in for a variety of issues, including substance abuse, mental health services, injuries, and illness. Denver Health is unique in that it is one of the few safety net hospitals in the state, which may explain why about 1/3 of its patients come from outside Denver.
Part of our mission and our sort of governing documents say we are to take care of people regardless of their ability to pay.
The cost of care has also gone up because nurses are leaving the profession for less stressful jobs.
Actually, in 2022, we spent over $50 million on what's called contract labor, travelers.
The Colorado legislature has fast-tracked a bill to appropriate $5 million to Denver Health. The hospital says it's cutting back and has a plan to break even by 2024.
It's a delicate balance between trying to be efficient, maximize what we can with respect to government reimbursement, but also educate the public about the amazing work that our surgeons and so many other people do at Denver Health for pretty much everybody.
Although lawmakers are fast-tracking this bill to authorize $5 million in funding for Denver Health, it still needs to pass the legislature and be signed into law. Live in the studio, Jessica Porter, Denver 7.
And Denver Health is not the only hospital in Colorado struggling to shore up funds. So let's go in depth here, starting with a look at the latest report from the Colorado Hospital Association. I did some digging into its 2022 financial report, and the data shows that in 2021, nearly half of all Colorado hospitals were trying to make ends meet. 47% reported negative patient margins. 56% of hospitals operated with margins under 4%, below sustainability. Now, going further, hospital utilization changed during the pandemic. While hospital discharges and inpatient surgeries decreased, patient days and length of stays increased, and that means hospitals caring for patients longer at an increased expense to providers. Now, according to a recent article in the Colorado Sun, these losses can also be attributed to investment losses when there was a downturn in the stock market. The article also points to research from a healthcare analyst who found in 2020 that Denver area hospitals posted nearly $1.4 billion in profits, suggesting those profits should have allowed hospitals to absorb the higher costs.
And looking closer here, the high cost of healthcare is a real burden on families. The Kaiser Family Foundation says 4 in 10 U.S. adults have difficulty affording healthcare, and that 1/3 say they or a family member have skipped medical treatment because of the cost. Also, people covered by health insurance are certainly not immune to this. 1/3, these are of insured adults, said they worry about affording their monthly premiums, and 44% are concerned about affording their deductible before the insurance kicks in.